Male, don't have a great model of a male here, so I'm going to be alternating back and forth between these two. First thing we need to talk about is there is a tube system to get from the testicle, and we are not identifying anything inside the testicle, to get the sperm from inside the testicle to outside. You get to see little bits and pieces as we look at these different ones. We are going to begin when we have a testicle. You've got actually the testicle itself covered by a tunica albuginea. From this testicle, you have the tube system begins as the epididymis. The epididymis begins at the superior surface, wraps its way around, and you'll notice on none of these models do we get to see it follow down. From there, from the bottom of the testicle at the tail of the epididymis, the tube will progress up through the spermatic cord, through the inguinal canal, and after it comes through the inguinal canal, it progresses across medial to the ureter, where it goes to the posterior. Okay, sorry about that. They have it coming up here. Progresses superior to the ureter, where it passes on the posterior and widens into an ampulla of the ductus deferens, and just to the lateral of it we have a seminal vesicle, the first gland involved. You will notice just inferior have a prostate gland, which you will also see on this model. If we move that apart, we can start looking inside, and you will see now that seminal vesicle enters with the ampulla of the vas deferens. They join together and form what is called an ejaculatory duct, one on either side. This ejaculatory duct then will send the seminal vesicle fluid and the semen into the middle of the prostate gland. You can see your prostate gland sits just inferior to the urinary bladder, and we call this part of the urethra the prostatic urethra. The ejaculatory duct then empties the semen into the urethra, and from there on, the urine and the semen follow the same path. The other gland that is associated with this is a gland that we would find in the membranous urethra, which is not visible on any of these. It is a gland, sits right here in the membranous urethra, called the bulbourethral gland, that then empties the basic mucus into the spongy urethra. We talked about when we're dealing with the penis, there were three major parts to it. You had a corpus spongiosum, the soft part that maintains the urethra open during ejaculation, and then you had two, right and left, corpus cavernosums across the top. These are the guys that fill with the blood to create an erection. You do not get to see a dartos muscle per se in here. The couple of things you can see on this model that we can talk about are, if you look at where the penis was, you can see the two corpus cavernosums and the corpus spongiosum. The other thing you can see is this massive conglomeration of veins, the blue blood vessels called the pampiniform plexus, create the air conditioner, and you can see the muscle on the outside called the cremaster muscle. The cremaster muscle covers the tunica vaginalis, which would be this part. This is the tunica albuginea. Tunica vaginalis covered by the cremaster muscle. In no model can we really say we see a dartos muscle, although I suspect that may be what they're talking about here. On the female system is a little bit more simple. You have a uterus, you have the fundus of the uterus, the dome top, you have the body of the uterus all the way through here until you get to the cervix. Cervix means narrowed area, and you have a cervical canal running through there. This is where the mucus plug is put. You have a vagina, which is an invagination of the epithelium, or the connective tissue, and connective tissue that were the same as the labia minora, as opposed to the labia majora, which is the same as the labioscrotal fold. You notice that the cervix hangs down into, and we have a widened area. This horns that stick up here are called the fornix. The other part for the female is there is a uterine tube. The uterine tube or fallopian tube hangs over an ovary which is suspended from the side of the body of the uterus by an ovarian ligament. The uterine tube or fallopian tube has four major parts. The narrowed area that literally enters into the uterus is called the isthmus. This one doesn't show it very well, but what you'll find right here, this begins to widen out. So I go from an isthmus to an ampulla until I come to the part that hangs over the top of the ovary, called the infundibulum, and then I have all of the fingers or fimbriae that literally sweep the ovary trying to pull stuff in. We talked about three major sets of ligaments that hold this in place. The first one was the round ligament, progresses through the inguinal canal, attaches into the labia majora. We have a broad ligament. I am doing a very narrow definition of the broad ligament. It is the thickened peritoneum, extends all the way across the pelvic cavity where we have this fold of tissue between the uterus and the urinary bladder. And so this whole area, broad area here, is called the broad ligament. I have two uterosacral ligaments. The sacrum, is curved and sits down here. So I have two ligaments. One goes to each side of the rectum, called a thick fold, called a uterosacral ligament. That's all we get to see on here.